Oops, good morning. Of course, the phone goes off right as we go live. Good morning, good afternoon. This is Dr. Almeida, Connie Almeida, and really welcome you to the first series of our lunchtime seminars focusing on mental health. May is Mental Health Awareness Month, and together with our partners, including the County Judge's Office, we're delighted to bring you just these conversations about mental health. So throughout the month, we're going to be talking about several things, including youth mental health, how to help our children deal with some of the stress and anxieties that they might be experiencing, first responders, compassion fatigue, how to understand a little bit more about mental health processes and mental health commitment. So I will show you at the end the flyers and the events that we have scheduled, and hope that you can share this with others and also attend these and learn more about mental illness. We really feel that this is the way we start to change the attitude about mental health. It's to start the conversation about mental health. Our goal is that we want to change the attitudes about mental health. We want to reduce the stigma. So we want to support recovery and wellness. And we know that for too long, the stigma around mental health, mental illness has been a major barrier to individuals who are struggling with these diseases to get the care that they need. So welcome to Mental Health Awareness Month. So today, we're delighted because we're going to talk and hear about youth. And, for too long, there was this sort of misconception that, mental illness doesn't really impact children, which is actually wrong. Mental health disorders often begin in early childhood, and half of mental health conditions usually start by the age of 14. So I want to point out a couple of things. That this week is actually Children's Mental Health Awareness Week, and May 7th is actually Children's Mental Health Awareness Day. So if you're, if you have a department, if you I'm not quite sure who's listening to us today, but on that day, I think there should be special recognition of the mental health needs of our children. Mental health disorders are very, very common in children. We usually talk about 20% of the children experience a mental health disorder in a given year, up to 20%. Of course, there's some variability. And really, what's really unfortunate is that only about 20% of those receive services from a specialized mental health professional. So we have a lot of children that are experiencing problems, experiencing a need, and not getting the care that they need. And as we know, children that live in poverty are even more impacted by this with limited access to care. Most of you know this, children's mental health. This is commonly what we see, a lot of anxiety disorders. Of course, that's been intensified by the pandemic, followed by mood disorders and depression. We're also seeing an increase in that. Attention deficit disorders, which have actually been the most common disorders that in children. But now we're seeing more of the anxiety and depression. And then also eating and feeding disorders. So depression in youth, which is a big concern, especially as a result of this pandemic, and it's often overlooked because depression in youth looks different. It actually looks more like irritability and acting out. So it's often misdiagnosed. So I think we really need to pay attention to this. Kids acting out, irritability, anger management issues can be a sign of depression. there's a study, some prevalence data that just came out from the Mental Health America 2020, and this is pretty significant. 13% of youth reported suffering at least one major depressive episode in the last year, and that's increasing. That's across national stats, of course. Childhood depression typo, to persist into adulthood if untreated and can be debilitating. In Texas, the percentage rate is 12.9%, so an estimated 296 children have reported experiencing at least one major depressive episode in the last year. So then we have all been impacted by COVID, and including our children. So what we've seen, and there's pockets of data throughout the system. So we've seen some increase in ER visits for children, pediatric visits, increase in psychiatric hospitalizations for children. And in some areas, we've seen increases in the suicide rates for children. I think we've all have heard those very tragic stories about young people taking their lives in the last year. This is a big concern, has been a concern for our adolescent population, and it seems like we're seeing younger and younger people, unfortunately, having death by suicide. Of course, we also see the anxiety about transitioning back to school, the depression and grief. So many people have lost someone to COVID, either directly or indirectly. And so how do we grieve? Recognizing that the impact of a crisis may not be seen until the crisis has been passed. This is a really important point that I want to make. And many of you have heard about post-traumatic stress disorder. So we know that often we don't see the direct impact of a traumatic event until several months after that traumatic event. Maybe 6 months, maybe a year. So we have to pay very special attention to this, especially as children are transitioning back to school, and also in ourselves. Really, really important. Just want to talk a little bit about this. This is actually something, I did not come up with this great slide, but it was already available. But when we talk about adversity and building resiliency, it's really a balance. We know we need to build these protective factors so that it can mitigate this adversity. You know, these traumatic events that we all experience. The way to mitigate that is to build protective factors and build this resiliency. And really our goal is to create a system for children where they feel they belong and they can thrive. And really our youth are at the center of that, followed by our parents, our schools, our community mental health systems. But our youth are at the center of that. And that's why this presentation today is so timely, because it is about hearing from our youth and the voice of our youth. I've added some helpful resources. So there's a lot of information out there. This is, for example, on trauma. The National Child Trauma Stress Network is a great resource. Harvard University actually has it's within their child development department. They're a great resource also. Of course, the CDC, and then several of the government agencies around mental health also have some great resources. And last but not least, and then I will turn it over to Shanika, and we can have a discussion. Just wanted to bring your attention to what we have planned for this month. So today is Youth Voices, talking about fears, anxiety, and resiliency. On Wednesday, we have What About Our Children? And that actually includes a live, you can attend in person over at the Justice Center, the Fort Bend County Justice Center on the 3rd floor. Then we have next week Supporting Children's Mental Health, Tips for Parents on May 12th. And we hope that several of you can come out and join us. It's a very short walk. at our Justice Center. But it's an opportunity again to demonstrate our support for mental illness and for working together to reduce the stigma and to improve access to care. Then we're going to talk May 17th. We're going to talk a little bit about serious mental illness, Dr. Martin and Dr. Tadaro. May 19th, very important, compassion fatigue, something that's very common right now and that several individuals are experiencing. May 24th, talking about normalcy and whatever that looks like, and even some of the fears and anxiety associated with that. And on May 26th, we'll wrap up with a discussion, again, a panel discussion about the Fort Bend County Mental Health Task Force, and that will also have a live attendance option at the Justice Center. Here's our phone number, 281-238-3079. And you can also email us at bhsdepartment@fortbendcountytx.gov for more information. So I am going to stop sharing, and I am going to turn it over to Shanika, who I'm sure will introduce our panel, and then have a conversation. Thank you.
Thank you, Dr. Almeida. I really appreciate that. Yeah, so we are lucky enough to have two lovely ladies this afternoon joining us for Mental Health Awareness Month and starting our launch of this series. So we have Annabelle and we have Destiny. Annabelle, would you like to say your age and where you are? You don't have to say your school, but you can say who you are, and then Destiny is same as well.
Yeah, I'm Annabelle. I'm 16.
Destiny.
I'm Destiny. I'm 20, and I'm a sophomore at Sam Houston.
Perfect. Thank you both. So like Dr. Almeida mentioned, we just want to kind of have a conversation with you to get a little bit of feedback of what you're personally going through with fears and anxiety and things of that nature, and how the pandemic kind of affects you. So Destiny, I want to start with you. Talk a little bit about the anxiety and fears and worries that you or your peers may have as you experienced as a child, adolescent, and now as a young adult.
Oh, I was a very anxious child.
Just cover everything, right, Destiny?
Oh, right, yeah. No, I recently had to get, I saw a new doctor, so I got reevaluated, and they were like, oh, that was there since like preschool. And I was like, oh, okay. But I didn't actually start getting help or knowing about it probably till about middle school age. And I didn't get it treated even till 18. So now that I'm in college, I'm finally getting to live more of a normal life, more of a stable life, because I didn't get treatment until I was 18. Well, medical treatment. And now that we're in college and we think we're getting normal, and then all of a sudden we get hit with COVID, which throws someone who I'm very routine oriented, so that threw my life into a spiral. We had no idea what was going on. Communication wasn't the best, so that makes an anxious person even more anxious. And we have a school where people unfortunately aren't very considerate about wearing their mask or protecting other people. So there's like, it's abnormal to wear a mask almost where I'm at. So there's a lot of anxiety there about, getting sick again, or, people I care about getting sick, or, I've seen the news recently about what's going on in India and how they're going through another wave. And, that as much as we have our vaccines going on, that could very easily, happen to us. So it's scary. It's definitely scary for, I know, me and my friends. My friend left her job because she was too scared to be around other people.
Oh, that's unfortunate. But I'm happy you share. Go ahead, Connie.
I was going to say, Destiny, I might come back to you, or I might, let's let Annabelle share, but I might want to come back to you on something about the routines, because I think you made a really good point in and just kind of like stuff that, probably was there when you were very young, but again, doesn't really get maybe the attention it deserves until later on. So I thought those were really, really, salient points that are very common. And so I kind of want to come back to that. But Shanika, Annabelle?
Annabelle, you're able to answer? You want me to reread the question for you?
Can you reread it?
Okay. Let's talk a little bit about your anxieties, fears, and worries that you or your peers have experienced as a child, adolescent, and now as a young adult.
I don't really know if I did it as much as a kid, but I know that now I have like my anxiety's a lot worse. And I mean, getting a job and stuff helped with that. But yeah. And then I started seeing a counselor because my mom thinks that it'd be better for me to talk to somebody else.
Okay. So can I follow up on that? Because Annabella and Destiny, you both talked about this anxiety, and sometimes I think it's really important to for people to understand what that looks like. What is that for you?
Destiny?
Okay, I'll lead it. As a kid, I think it wasn't very noticeable to other people, but I would do things to make it so the attention wasn't on me. Or like it's on video. There's a video of me as a kid at a preschool performance where I was so anxious about being in front of other people that I purposely made myself trip so that the lady helping us up the stairs would like be distracted, because I was just so anxious about being around other people. And then as I got older, I got a lot of anxiety about leaving the house. I didn't like to leave my house ever. There was about a solid year after I started online education where I just didn't leave the house. I don't know how I maintained friendships, but I just didn't leave the house. I would get very overwhelmed. Like if I was driving somewhere and I could see what the parking lot looked like where we were about to go, if it was too full, I wouldn't get out of the car. Or if I would get overwhelmed in the store, I would get an attitude. Like I would get too overwhelmed. There was too many sounds. There were too many people, and my attitude would switch. It still happens sometimes when I get overwhelmed in a store. Even my family knows that when I get like an attitude, I'm overwhelmed or I get really hot.
And I think the fact that you even got a driver's license, I don't even know how that even happened, right?
Yeah, I think I got really lucky. I have really good parents that were very patient, and they adapted basically their entire life to making it work for me. So I got lucky that both my parents were able to work from home and just spend time with me. And my dad had to teach me how to drive because I didn't want to go to driver's ed. So my dad, who's very busy, took time out of his days to teach me how to drive and to make sure I got my hours in. And even then, I had a panic attack after when I took my first exam. I had like a breakdown because someone was mean to me.
Destiny, that is just, you just talk about so many important things, like that anxiety and how it looked different based on different situations. Okay, kind of like, just you shutting down, sometimes. And then there were other times where you probably maybe got a little upset or angry or something, kind of when it was just too much for you to deal with.
Oh yeah, it was like a personality. I'm very, like, me and my mom are like very good friends. Like we're basically friends. I respect her so much, but she knows that like when I start being rude for some reason to her in the store, it's because my anxiety is up.
Yeah.
And even though I don't intend to be rude, that's
Right.
what it is.
Right. And I think what's so important too is, right, what you just said. It's not this intentional thing that you plan on doing it. It's how you're able to regulate. It's like your emotional regulation and what's going on in your body and your brain. And, and what you also talked about, which was really a good point, is how your family support was so critical. Like your family, you're right, very fortunate that they can make these modifications to provide that safety for you, you know, so you can
Oh yeah,
kind of
Shanika knows. My parents were every day. My parents know Shanika like she's a family friend as well because it was all hands on deck.
right. But I think that's a really good point. It's like then you think about, children that are struggling with anxiety, right? But don't have that, and still have to go to school, or, there's nobody there listening, and, there's none of those modifications. So you can kind of see how then those kids are so much more at risk.
Oh yeah, I completely get it. I have friends that unfortunately their parents don't take mental health seriously, so it took until they were 18. Even now, 20, some of them don't get treatment because their parents just don't make it a priority for them. And their parents don't experience it like my mother did, so they don't have that understanding.
Yeah. I think that's a really good point about the understanding and the knowledge and starting to have those conversations. There still is such a stigma, about mental illness. And I'm hoping with, at least with COVID, because it's become so prevalent. I mean, people that never thought they would be depressed or struggling or irritable, all of a sudden experience that. So I'm hoping that's one of the positive things that maybe comes out of this pandemic, is that there's actually more awareness about how under lots of stress and unusual situations, we can all really struggle with these things. So I think that's a good point. I'm sorry. I guess Annabelle, right? Shanika?
Yeah, Annabelle, maybe you can explain what anxiety looks like for you.
For me, it's lots of sweating and playing with my hair and biting my nails. Typically, it's only like if I go like at work, whenever like we just opened up and people are allowed to come inside, and I can't give vaccines or anything because I'm nervous because the owners won't be rude. And so like it makes me really scared. I have to like walk out of the room because I get really nervous. And then like going in stores and stuff, like I could be going to get cat litter and I'm like absolutely terrified. And I typically want my mom to come with me because I'm scared.
So have these things been normal, or did they happen because of the pandemic? Like what was before and then what is now because of the pandemic? Because your situation is a little bit different, like I explained. So Annabelle came from Louisiana here to Texas right before the pandemic. So she was shut down from something she knew friends, knew about her environment, and then came here and then had to come to a whole new city and shut down.
Yeah, at home or like back in Louisiana, it was definitely I was like bold and like not scared of like anything. Like everybody knew me, I knew everybody. There was nothing to be nervous about. So like it all developed whenever I moved here.
Annabelle, that's a really good point. Again, it's like, so sometimes we all need like these safe zones, and especially children, like you need adults too, but we all need a place like where we feel safe, kind of like where we can kind of go back to retrieve, like we do some work with babies, and there's a lot of research around attachment, and it's pretty fascinating actually. Like children that feel safe are more likely to explore their environment, which leads to better academic performance. These are like babies and, preschoolers. And you think about it, that makes such sense, right? Because you have to be safe, like you have to be like have a safe place so that you can feel okay in going out into the world, right? To learn, because it's like, whoa, if something happens, I have a safe place to go to. And I think, like when we're working with abused children or, again, children that maybe don't have a safe environment, like it's not safe for them to go out into the street and play. Their neighborhoods are not safe. I mean, those kids can't go and explore because they might get shot, unfortunately. But with this pandemic too, just think about that. It was like, oh, all of a sudden, none of us really felt safe in going out into the world and to explore. So and you moved right in the middle of that, I mean, that's really, how do you think, I'm sorry, can I ask a question, Shanika? Sorry, I'm kind of going off the.
No, go ahead. This is a conversation. This is the whole
Yeah, so it's a
point.
conversation because you're both talking about this and transitions and Destiny, you talked about the routine, kind of that was like as long as you had your routine, you kind of knew you knew what to expect and how to kind of control things, right? The
Oh, yeah.
routine kind of goes away, Annabelle's neighborhood safety, goes away. So talk about, or if you can, like this whole transition to school, I mean, some kids don't like school. A lot of kids don't like school, but you kind of know you got to get up and you go. You know what I mean? And then now it's like, well, you can do virtual or you can go. How do you think kids are going to process that or are processing that as they transition back to school? And I know you both have different ages and experiences, but just kind of your thoughts, even at the college level.
Yeah, I would say I liked the idea of online education. I did it my entire before college. I was mostly online schooled, but it's a whole different ballgame when you're in college. You trying to teach yourself chemistry too is not fun. So I actually am very excited to be back in person for I have a good couple of classes where I was actually able to go in person to our lecture, and it's a completely different learning experience. My grades have been improving since last semester. I'm getting pretty much all A's and like 1B. And so I was like really proud of that this semester. But I know the transition for younger kids is a lot harder. My little brother, he was doing the like through the school district online, and that wasn't working. They're actually going to transition him into the online school that I grew up doing, because unfortunately these teachers just they didn't learn to be teachers online. They learned to be teachers for public school in person. So we're getting him into a program where that's their goal, is completely fully online education. So I know it's harder for these kids because it's harder for them to hold themselves accountable. Like, to maintain your own schedule when you're like 12 or 13 is not easy. And to, get your assignments in when you have to, when there's not a teacher over you, it's hard for them. They don't have that part of their brain isn't fully developed. That self-control isn't there. And I know they're playing their video games, they're calling their friends, and unfortunately it's affecting their grades. But I think they're going to appreciate the transition to in person, get to be around their peers, but it's going to be hard for them to get back to having to listen to somebody, to actually be told what to do.
That's a great point.
That is a good point.
Yeah. Annabelle?
Um,
Are you
since
transitioning back to school?
No, I'm homeschooled, so I don't really know what it's going to be like for them to be transitioning back. And I don't have enough public school friends to know what they're going through.
Yeah. And you're okay with staying homeschooled, right?
I want to go back to school because I was in public school back in 7th grade, but I don't want to go back.
Yeah, we sounds like we were very similar. We weren't into it.
Very, very similar. I want to ask one question. I thought Connie was going to ask it, which she probably was, to go back to one of the things that Destiny had mentioned. As you were going through your transitions of figuring out what's working for you and what didn't, and I know your history, kind of talking about the struggles that you went through to try to find the right person who diagnosed you and to try to find that help, where are those resources? Like what advice would you give somebody going through that? Because that was a good couple of years of stumbling through things, getting used to somebody, trusting somebody. And here you are saying, what, at 18, you finally found something and it clicked.
Yeah. So it started, what age are you in sixth grade? Like 12, 13? That ish?
Yeah.
So 12 or
Young kid
13,
12.
I was going through some stuff and I got some visible stuff. So I got called into the counselor's office and my life got rocked. And my parents had to show up at the school and they're like, what are you doing, kid? This isn't cool. And so they actually took me to the ER, the pediatric ER. I got evaluated and they had to decide if I was going to be inpatient or outpatient. And they said I could be outpatient, just, find someplace. So we started with just therapy and I didn't like it. Because I felt like I knew what they wanted to hear. And I told them what they wanted to hear because I didn't want to be there because I don't like talk therapy. It doesn't work for me. Traditional talk therapy, at least, doesn't work for me. So we did that for about a year-ish. And then I met Shanika. And that was basically like my saving grace because I was miserable with my counselor. I was still in school and my counselor, she thought she knew what was best for me, but unfortunately Shanika was more like, if you got to leave school, you got to leave school. And so once I left school, I was able to focus more on like getting everything under control because when I was at school, that was such like a hostile environment for my mind and for my mental health that I couldn't focus on anything other than survival. So once I left school, I was actually able to get treatment and not really treatment, I say, but like I was getting some kind of help through Shanika was getting me out of the house and out of my little hermit crate. And we tried psychiatric like medication and stuff, but it didn't really work. And I wasn't about to be told what to do at that age. So my mom understood and she let me get off the meds and it took a while, but I think my hormones had to calm down because that was I think that makes mental health like 10 times worse. So once they balanced out, I was stable for a while. I wasn't doing talk therapy, but I was still seeing Shanika through her old organization and I was good. And the plan was always once I turned 18, I would go to my mom's psychiatrist who we knew and we liked. And so I did that, and he got my medication right. He got my depression meds right on the first try and my anxiety meds right on like the second try. And I'm still on those meds to this day. I see someone else just for convenience because I moved for college, but I'm still on those meds. They still work. I'm a big fan.
Destiny, you pointed out a couple of really, really good points. I've been doing this work for like 35 years, and it's too often it's like, well, they're not going to go to a therapist because they ask them the same questions over and over. They sit there and take notes. I mean,
it felt very like I was never treated too much as a child. Like my parents understood me mentally, so I never felt like anyone was really on a different level than me. But when you get there and there's this adult that makes you feel very small and they're like this position above you and they're writing down what you say. And I'm like, I just couldn't trust her. Like she didn't feel like a friend. And I wanted someone who felt like a friend. So that's why me and Shanika worked. Because I'm like, I understand that therapists have to set like this very strict boundary, but I'm like, then I don't really want to like talk to you about stuff. I don't trust you.
No, it's you make a really good point because you also made a point that I hear so often. I just kind of told them what they wanted to hear, I mean, and so that your relationship with Shanika also, in psychology, what we refer to that as this therapeutic alliance. And it really is like critical, like having that individual that you have an alliance with. You know, you're like a team. There's this trust. Yeah, we all have to have boundaries. We got that, you know. That it's like, and this happens too often if we as mental health professionals can't convey that we genuinely care, we're not going to get there, you know, and that is a struggle because sometimes people think, well, if I convey that I care, then, you know, my boundaries and all that. Now you got to do both, you know. But I think that was really appreciate you sharing that, and that is a challenge for mental health professionals. So that was good. Annabelle, what about, I forgot what the question was, but you know.
I just asked Destiny to share because she had talked about her struggles to try to find the right fit.
Yeah.
So, and Annabelle just started therapy. So maybe Annabelle, tell about your journey so far that's gotten you here, because I think you said your mom made you see somebody, right?
She didn't make me. She was just kind of like, I think it would be good because I started like not wanting to tell mom everything under the sun like I was before. So she got me a counselor that she knows, and it's not bad. I've had one before. It's not like it doesn't bother me, and I tell them the stuff like I would tell anybody else because I don't really care enough to hide things. So I'm just like, I just kind of like spill it out. I have 45 minutes and I tell her everything that's going on with my life. So yeah.
Yeah, it's a good point. I was going to mention, you know, finding the right person and having that relationship, which seems like you both do. Destiny, you also pointed out a couple of really good points in terms of, you know, that balance around the medications, how that's really, really critical, and often hearing that people are having side effects, you know, and also, I mean, you both know this. I think a lot of folks know this. Medications often take a couple weeks to work, and it really is that balance between the right meds with minimizing the side effects. You also pointed out something really important, that adolescence, there's hormone changes, you know, and so you need to take that into consideration because there are a lot of mood swings during adolescence that are just part of hormones and adolescence and all that, and not necessarily indicative of, you know, like a mental health disorder. But I think it's just really important to have that complete picture. So I had a question, back to the routine. So how have you compensated for some of that during COVID?
This is bad. I have made a new routine, unfortunately, of going to Starbucks every day drive-through. So I don't have to go out in person, but it's like this thing where it's like, I know if I do anything that day, I get to go do this one thing for myself, even if I'm busy, have exams, I'm studying, I get this one thing for myself. And I love car rides. So like, I find them very calming to go on car rides. Even when I was a kid, my mom had to drive me around to go get coffee because when I wouldn't leave my house, that was my one thing I would do, is my parents would take me to go get drive-through Starbucks. So that has come back around. I was not as bad about the Starbucks before the pandemic, but and especially on campus, I wasn't that bad. Like, we had Starbucks on campus, but I wasn't that bad about going to get coffee. But it's bad now. I go every day. I talked to my mom recently. I'm like, are you sure it's not too much? She's like, unless your dad says it's a problem on the credit card, we're fine. Because I have been going every day, unfortunately. And I have night class, so I need it, but
Yeah. Well, you know,
a new routine. It's very calming.
I think that's interesting because you talked about that. It was also the car ride, the fact that it gets you out of the house, it gets you in the car ride. For you, it's soothing, and then you get your coffee. And, you know, one of the things when we started talking about this pandemic, and you hear a lot about coping strategies, you know, it's like find something that's not related to social media and not the news and, you know, kind of like how do we quiet the noise around us? But, you know, some suggestions about, you know, cooking. That's why everybody all of a sudden became chefs, right? But gardening, I mean, you know, everybody's gardening, but it's kind of that, you know, something that you can do that was safe and provided some routine. So I think that's an excellent example. Annabelle, is there like a coping strategy that's helped you kind of just get through this pandemic, especially during the last year?
Pretty much my job, being able to go and be around other people,
Yeah.
and like having like people that I see every single day is
Great. So what is your job? I'm curious.
I'm a veterinary technician at an animal hospital.
Great. Well, also being around animals, you know, I mean, you've all have seen some of the headlines how, you know, we've had more pets being adopted. And also we still have Fort Bend County animals that could be adopted, right, Shanika? But everybody really, you know, because we know pets can be so calming and therapeutic. So I think that's an excellent example. Okay.
For me, my pet gives me a routine. I have to get out of bed. Like especially now that I live alone, I have to get out of bed. There is no choice.
Yeah.
So it's really helpful. It helps you get up, helps you you have to go to the store. You have to do these things or else
That is true. Yeah.
you're
To go
That is
walking.
true.
Yeah. That's why they're having a shortage on pet food or something. You know, I've heard that. So, yeah.
And not only that, not only that, but also the animal shelter, there's not that many to adopt anymore. So people are really
Yeah. There was a shortage somewhere, so that's great. Okay. Shanika, do you?
Yeah.
If not, I can.
Yeah. No, I had a question too. Just based, I mean, I know you guys I know you kind of talk about different people here and there and how you interact with those. But what do you think or suggestion you would give like Connie or I, who we're trying to do things within the county or we're working with other individuals? How do we reach out to other youth to get them the resources that they need? Like at this point in time, with us being kind of semi-locked down, but still trying to get out and about, what's the best way that you think that we can reach out to those that are suffering? Is that hard?
give them an online. No, I would say give that. I don't know if you can, but give them the online option to meet with you, like Zooms and stuff. Like they even do it for like advising now at college. But just give them the option to do it online. Like make it way more easier, basically, than you would typically make it, because I know as a youth, I did not go out of my way to do things. So if you kind of put it in front of their face and be like very obvious about it, we'll do it.
Makes
Also,
complete sense.
majority of youth don't talk to us like we're children, because even I remember I hated that as like they put me with like a pediatric counselor at my age, and they literally, I was like 13, I think, and they were making me play with figurines, like animal figurines, and I was over it. I'm like, we are more mature than you think. Just because we're goofy at this age doesn't mean we don't know what we're talking about or that we don't want to be treated with respect.
I think that's a good point to be had. I mean, right? Meet you where you are, not just make assumptions that this is what you might need. Yeah.
Exactly. I think that's a really good point with the respect. And as Shanika said, you know, like, let's not just assume that we know, you know, what you need. I mean, I always think of like when like even like talking to professionals, I always think, well, you know, we might have some tools that, you know, kind of this toolkit or these tools because of our training, but really individuals have the power to do the changing. I mean, it really is, you know. I think that's just a really important thing to remember, but the respect. And so what about Annabelle?
I really don't know because like the girls my age, or girls and guys, like I know one of my friends, she needs to talk to somebody and she doesn't want to because she's embarrassed for anybody to find out that she has a counselor. And I guess that's kind of like weird for me to hear because like I didn't know it was weird to have a counselor, but like she doesn't want to talk to anybody. But like I don't know. I guess it's like nice to like have somebody to like instead of like my old counselor, she'd like we'd talk about one thing and then as soon as I was done talking, she like instantly hit me with like everything that she thought that like things that she thought that I needed to do. Whereas my counselor now, she'll just kind of like let me talk. And then like at the end, she kind of like gives me like a, I don't know what it's called, like a
synopsis.
prize, like a what?
Like a synopsis of what, she just summarizes everything that you said and gives you suggestions.
Yeah. And I think that's a lot better of a way than what the other one used to do.
Is she more of a guide, Annabelle?
No, she's
No.
she's like a literal counselor. She just, I don't know, she just takes it differently than than the other one that I used to go to.
Yeah. You know, you both make a really good point because I've seen too many people like, you know, when we suggest, for example, that somebody might benefit from therapy, they're like, I've done this, you know, I've already gone. And some people have had really kind of not very positive experiences, you know, for whatever reason, you know. So I hope it's hopeful to hear you both say that. It's like, okay, it might not work out, you know, for whatever reason, a combination of factors, you know, the first time or the second time that you see somebody, but then you both have had these great experiences where you found a safe place that provides guidance and suggestions and where you feel safe talking about things. So, I mean, I hope other young people don't give up just because they've had a bad experience. You know what I mean?
Yeah, I think we kind of got to start treating it more like a life coach kind of thing. Because that's how, like, when I try to explain who Shanika was to me, I'm like, well, she wasn't a counselor. But if I say caseworker, that's not really going to make sense. So I'm like, I call her, like, my life coach friend. Because it's not, like, therapy isn't always about, like, I had this one thing happen to me and I need to talk about it. But it could be, like, I want to, like, organize my thoughts and prepare myself for like what I'm doing in the future. Like I want to get a plan out. I want someone to help me feel like I have order in my life where they can help you grow as opposed to like, I have this one issue and I would like treatment.
No, I think that's a good point. I think that's the reason why we have so much stigma around mental health, right? Maybe if we redefine it, maybe people like your friend Annabelle won't be so shy to say that she's seeing somebody. And that might also be how her background is and how she was raised as well. You know, you just don't know. You don't know
Right.
the reasons why she might feel that way because there's all different backgrounds of why people feel they do about mental health and why some are more open than others. So it's just different.
You know, as I hear you all talk and, you know, Destiny, the life coach, and there's been a lot of research around using peers to help. Because it's like if you have that lived experience, you can connect better with somebody going through it. You know, but I'm thinking, you know, like in athletics, in sports, people are so into coaching. You know, why can't we have the same sort of model for mental illness, you know, or for mental wellness? And, you know, even stop calling it maybe mental illness and just call it mental wellness. So
There you go. That's the first step right there. Change the word.
yeah. So I think we only have like 5 minutes. So I have, I just, So if there's like 1 to 3 things that we should be doing to support youth and their families, what would those be? So between 1 and 3 things. If you can't come up with any, of course. Destiny?
I think we gotta realize how expensive it is for people to actually get help. Like if I was doing this on my own without my parents, I couldn't afford my medication. My medication's almost $400 even after insurance. So I couldn't imagine people who are in lower income or don't have as good of insurance. Like sometimes these people can't get help. Like they need affordable options, affordable clinics. Because the only medication that worked for me was $400. Like there are people like that out there that are in lower income situations where like the $15 Prozac isn't going to work for them, so they're going to need to do something way more expensive, but they can't afford it. Like I would love to see a low income like health clinic for mental health because it's so expensive.
That's an excellent point. So even if you have insurance, those co-pays for the medications, some of the medications.
Yeah,
Excellent
every
point.
time I get it filled, it's nearly $400 every time I get it filled, no matter if we meet the deductible. It's insane. So there are people who don't have good insurance where that's going to be, I think I did the math, it's almost $1,000 to get it filled.
And that's just the medicine. That's not even the visit to the psychiatrist, right?
Right. Yeah. If you go to the psychiatrist, the guy I was seeing without insurance, because they don't cover it, it's like your first appointment's like $200 or $300 just to get diagnosed. It's insane.
Excellent point, Destiny. And I think I kind of alluded to that at the beginning about, only 20% of the children that have some mental health need get care. But then, of course, if you're poor, then it's much less because, again, the access to care. That's a great point, Destiny. Annabelle, so 1 to 3 things that, we should be doing to reach more youth. If you can think of.
I have a thought. I just don't know how to put it. Like make it more of like a normal thing, like normalize it. Because I feel like that would help more people.
And how would we do that?
I didn't think that far into it.
Okay. Do we have like more like you said, like online courses? Do we bring in
I
people that
definitely like doing online more than I do having to like go in and
Right.
stuff.
I would hit the schools. I would have events where you go speak at the school and then leave like a pamphlet where like, here, if you want more info, here's our Zoom. Everyone gets the pamphlet anyways. No one has to know who actually goes on that website and goes to get help.
Right.
I'm like a chronic oversharer, but like I get that people don't want to talk about it. And a discreet way for them to just get even just plain information, not even help, just information would be good.
No, Annabelle, and those are great points and kind of this normalization, like you're right. Like, look, this is one of the most common things that we have in our society. We have millions of people struggling with some sort of mental health disorder every day. It's common, it's so prevalent. It looks differently, but it's so prevalent. And, maybe changing the wording to, mental wellness. But also, we accept other diseases, we accept other conditions, yet when it comes to mental health, we still have this stigma that somebody did something wrong and that's why they have this condition. And so I just think this is so timely, and this is a great way to kick off, May is Mental Health Month, because that's actually what we're hoping to do. Maybe you can come out for our walk. Then you'd have to on May 12th. I know we're right at the hour, so I really, truly appreciate your time, but also just listening to you. It's been inspirational for me because I know that 20 years ago, definitely 35 years ago when I started my career, we wouldn't have youth being able to come and talk. So this is great. Thank you.
No, I appreciate it. You guys are a joy. And Annabelle lives not too far, so she should be able to come to the walk.
We'll get you
I have
a
a
t-shirt,
final. I
Annabelle.
have a final that day.
Oh, you
Unfortunately, I have
do?
my.
You do?
I got hit with the final on the 12th, so unfortunately, I would normally go.
We'll send you a t-shirt, Destiny, as a thank you.
All right.
Thank you.
Thank you. Thank you both.
Bye. Thank you.